So now let's go with question 8. A 68-year-old woman presents to the office for a 1-week history of purpura in her lower extremities, as well as arthralgias in the hands, the edema of the lower limbs, and weakness. She has a past medical history of IV drug use and shared needles. Important information. Her pulse is 88, respiratory rate is 18, temperature is 36, which is 96.8 degree Fahrenheit. And Fahrenheit tells you the fever. The blood pressure is 140 over 88. Okay. Blood laboratory analysis shows the following: hemoglobin of 10.8, which is anemic; hematocrit of 34, and again anemic; platelet of 2,25,000 per millimeter cube; leukocytes are normal; serum creat of 2.2, which is elevated; BUN of 43 milligram per deciliter elevated; C3, which is complement factor 3, 86, and the range is given, which is 90 over 180. So 86 is low complement C3 factor. C4, 2.3 milligram, and the range, normal range is 10 to 40. So both we have hypocomplementemia. This is important finding. ANA negative, ANCA, that is ANCA antibodies negative. Proteinuria 2.1 gram. Okay, elevated. Urinary sediment, leukocytes, you don't usually find leukocytes, so that is, and erythrocytes. Okay, so with that is also elevated. HBV, HCV, both serology are negative. HIV serology positive. Okay, so the patient is an HIV patient. Which of the following is the most appropriate next step in the management? Option A is antiretroviral treatment. Option B is dapsone. Option C is gabapentin. Option D is prednisone. Option E is prednisone plus rituximab. So over here, the important thing is purpura over her lower extremities, arthralgias in hands, edema over legs, and weakness. Okay, this is seen in, we can say, HCV causes mixed cryoglobulinemia, but even HIV causes mixed cryoglobulinemia. This particular presentation, that of purpura in the lower extremities and arthralgias, is that of cryoglobulinemia, mixed cryoglobulinemia syndrome, and it is most commonly associated with hepatitis C, but we can also see it in HIV serology. Okay, hypocomplementemia is seen with it, so that is important. So remember that there is hypocomplementemia. Then you have elevated BUN creatinine. So the RFT, renal function tests, are out of range. All right. So that is commonly seen with HIV and hepatitis C. But here, since we are given that hepatitis C titers are negative, so HIV and an HIV is positive. So what do we do here is that since we do not have any treatment for HIV, we just give antiretroviral treatment, which will bring the HIV count under control, and then the immune system will bounce back, and it will clear off all the viruses, and we will again have a normal, functional physiology, which will clear out the libido reticularis that we see in a mixed cryoglobulinemia.
Thanks for watching. Please give a thumbs up and subscribe for more.